Welcome back. If you are just joining us, good morning to you. You are still watching NAMIBIA Connect on NBC. Now, today is International World TB Day. Joining us in studio to talk on TB matters is Sister Faustina Amutenya, a district TB and Leprosy Coordinator for Windhoek. As you would know, the Ministry of Health and Social Services, in collaboration with the Commerce Regional Health Directorate plus partners, as today is, of course, International World TB Day from the 24th until tomorrow, the 25th of March. The Ministry of Health and Social Services, in collaboration with the Commerce Regional Council, will host a free TB screening at the Katutura Health Center, that is at Black Chain in Katutura. And joining us in studio, of course, like I mentioned, is the Sister Faustina Amutenya, a district TB and Leprosy Coordinator for Windhoek, to come and share more on what, of course, we can expect for today and tomorrow. Sister, thank you so much for joining us. Thank you so much. So welcome to NBC.
Thank you for having me.
It's a pleasure to have you. Tell us more about the purpose of the free screening campaign that is going to be happening at Black Chain, that is today and tomorrow at the Katutura Health Center. How important is it and what can we expect?
Okay, the purpose of the campaign, it is part of the World TB commemoration. Is today, the 24th March, is an International TB World Day.
Yeah.
In Namibia, we have many cases of TB. We are among the top 10 worldwide, not only in Africa. So TB remains a higher infectious disease, and it's also number one, the disease killer. So in Commerce region in Namibia, we have quite a number of cases which we are missing, and these cases are out there in the community. These cases are out there at home. Now the challenge we have, these people doesn't know whether they have TB. And the only way to know is only when we screen these people, test these people, and put them on TB treatment.
Very well. Now, apart from, getting screened, what are some of the signs that one could have or could see, the early signs to detect whether one has TB?
The signs and symptoms of TB is coughing and loss of weight. You lose weight not deliberately where maybe you want to lose weight. Night sweats, fever, as well as swellings. It can be in the neck or under the arms or on the groins. Yes, that's are the signs and symptoms.
Very well. So how does the screening process then goes? What can the community members expect when they arrive at the Katutura Health Center for screening? How does the whole process go like?
Okay, the process will go like this, and at the beginning, I think you talk about 24th and 25th.
That's right.
But this activity, this campaign will be for 7 days.
7 days.
We will do it from 25th up to the 31st.
Very well.
So what will happen when the community members come, they will be interviewed. They will be asked questions so that they give their details as well as their demographic, and then they will be issued with a card to take part. From there, they will be taken a chest X-ray. And there will also be a doctor who will read this X-ray. For those where they detect any abnormalities, then they will be dealt accordingly, and from there the sputum will be taken. People have to cough and give this sputum so that it will be investigated for TB. And then depends on what is findings, every patient will be treated accordingly, and then we will follow them up to give them the results of the this sputum which they give.
And how long does the process take for one to get the results of whether they have TB or not?
On the X-ray, they will detect whether there are sub-abnormalities or not. But for the sputum, we have to send it to the lab. We have to send it to NIP. The result will anyway just take, will be out within 24 hours.
Within 24 hours?
Yes.
Very well. Who then is eligible for screening? Is it everyone of all ages? Is it all genders as well? And do participants need to bring any documentation to, of course, or to meet any specific criteria for them to actually meet the criteria to be tested for TB?
There is no criteria. Everyone is welcome. All the genders are welcome, whether the person is sick or the person is not sick. But the pregnant woman, when we come to the X-ray, they might be excluded, as it might not be safe for the unborn baby. So everyone is welcome. And since it is a health facility, they can bring their health passport in case if we want to look something there. Otherwise, if they happen not to bring it, we will issue these participation cards.
Very well. For those who probably might be wondering or having so many questions about TB, what are the main causes of tuberculosis? Because we also know smoking can also be a very big cause. But are there any other? Because one would probably even be tested positive for tuberculosis, but might not even be a smoker. What are some of those causes?
Some of the causes of TB, it is caused by a bacteria.
Very well.
The name of the bacteria is Mycobacterium tuberculosis.
Very well.
And this bacteria will come from an infected person when this person is coughing or talking, because it goes up in the air. And then everyone who breathe can then breathe in this bacteria and can then be infected with TB.
Very well. Will there be also any other services of information sharing during the campaign tomorrow?
Yes. We will tell the people on how to prevent TB, what should they do so that they prevent TB, and what are the causes, and to visit also the health facilities as soon as they get that, they have that signs and symptoms, so that they can be diagnosed earlier, put on treatment earlier.
Very well. There are also those who feel very hesitant, or they are afraid. They fear the stigma associated with the TB. What is your message to them in terms of, how they can actually how you can actually, give them that confidence to actually show up tomorrow, perhaps to also, make sure that they get tested, that they also are found, or they get the necessary help if they are tested positive, or rather even get the necessary advice to further take care of themselves if they are tested negative?
Those who have a fear, they should come, everybody should come, because this disease can affect anyone. It doesn't, regardless of the economic status. And it's not true that everyone who have TB is also having HIV. There are some people who have TB, but they don't have HIV. Yet, if a person happens to be infected with both TB and HIV, they need to be treated for both, so that the way they become healthy, it will be faster and it will be 100%.
Very well. Thank you so much for being here. Thank you so much for sharing this very important advice. Perhaps just another advice to the members of the public to, of course, show up tomorrow. And how actually are we going to be further celebrating World TB Day?
To the members of the public, come one, come all, we will be waiting for you. And because that is one of the activity in our region which we will celebrate, because we want now those cases which are missing, those people are sitting at home, they have TB and they don't know. We want to detect them. We want to diagnose them early so that we can put them on treatment. Because once we treat these people, this is the only way for us to stop TB, because then we stop the infection to others.
Very well. Thank you so much, Mr. Amutenya, for being here, sharing all this information. We wish you all the best for tomorrow.
Thank you. You are welcome.
Thank you so much.